Hello, I'm Dr. John Luther. I'm a retired family doctor. I had to buy hearing aids this year because I was getting older, and read a lot about hearing and talked to specialists and audiologists about hearing. Let's look at the ear model. There's the ear model. Let's bring it a bit closer. Yeah, we can have a good look. Here we have different parts of the ear. Let's go through it from the outside. Everybody calls this the ear. In medicine we could call it the auricle, but ear is better. It's an English word. There's the external ear canal. It's going in here. Here's the eardrum. This eardrum's white. That's just a piece of plastic. It should be pink, very shiny, almost translucent, maybe like a piece of wax paper. This is a middle ear and inner ear. Middle ear has three little bones, which we'll show you later. Middle ear drains into the nose periodically, and that's to prevent infection. In this part of the ear we have the cochlea. It looks like a snail. We'll show you that snail later on. It's quite interesting to look at. And the auditory nerve going into the base of the brain. Any obstruction in this area, external ear, middle ear, and part of the cochlea, is called conductive deafness. It means vibrations aren't moving through here, but physical vibrations like sound waves, physical vibration here, physical vibration here, physical vibration in the cochlea. If there's a nerve in the cochlea called the spiral ganglion that goes around the spiral of the little snail. If that nerve is having trouble, that's called electrical deafness or nerve deafness. If the auditory nerve doesn't work very well, that's called nerve deafness. Sometimes it's called electrical deafness. Let's look at an obstruction in the middle ear. Here we have some yellow stuff, which is pus that's supposed to drain down into the nose. So your child gets cold, cough, fever, runny nose. This obstructs a little bit and you get pus forming here. This can be from a virus or bacteria, but we don't know looking at it. All we know the eardrum is usually swollen and red. So we see an eardrum that's swollen. It may actually leak a bit as you show, and the little drops can come out. If this does form a hole, the person may feel better in half an hour. We usually treat this with amoxicillin. If the person's allergic to penicillin, we can use erythromycin, sulfa, and other drugs. Let's look at the little bones behind the ear. There's three little bones, and we call these the hammer, anvil, and stirrup. You can see that looks like a stirrup. And they have to vibrate for conductive hearing to be normal. If there's fluid behind the eardrum and these little bones can't vibrate, you're going to feel a little bit deaf. To drain any fluid, assuming there's fluid persisting after an infection there, and the person says, I can't hear very well, you can put in a little drainage tube. There's an artificial drainage tube put into the ear. So we see this little tube. It's a synthetic hole made of metal or plastic. That's done by a specialist with an operating microscope. That will fall out in 3 to 6 months, and the specialist is looking frequently to see if fluid reforms. If there's new fluid coming, then he'll put another tube in. With kids, they sometimes do that 2 or 3 times until the ear gets bigger and don't need to put the tube in anymore. Let's look at some conductive deafness and what else you could do to diagnose it. So here's the fluid going through there. The bones aren't vibrating very well. Eardrum isn't vibrating very well. We can take a tuning fork, make the tuning fork vibrate. So the tuning fork is vibrating, and the person says, I can't really hear it very well. Make the tuning fork vibrate again, hold it to the skull, and the person says that's louder. So here, not too loud. It's actually louder when you touch here. That's quite amazing. So the sound waves are going through the skull, into the brain, and into the cochlea directly, indicating there's a conductive obstruction here. Let's look at some other things that can obstruct the external ear canal. Here's some wax in the ear. This is very common, so if you do feel you're deaf, don't worry right away. You go see if you've got wax in your ear. Any family doctor can do that for you. Here's a child with a bean in the ear. So there's a bean in the ear. This is very important. If you think there's a bean but you can't see it, try and see your doctor as soon as you can. These can start to swell up and germinate in the warmth and the moisture of the human body. So it can get really stuck in there if you leave it 3 or 4 days. Let's look at a hole in the drum. So this presents an infection, a hole has formed in the drum. We see a hole there. It can be in the center or it can be peripherally out here. If it's more peripheral out on the edge, that's more dangerous as far as getting to heal up. Usually these heal up before you even see the doctor. They may only last half an hour, then gradually heal up. If they're draining pus all the time, you can put antibiotic drops in 3 or 4 times a day. If it's a fairly new hole, they can put a connective tissue graft over here from under the skin, and they will sometimes heal. Ones that persist, pus is coming out, they've been treated several times, quite often these will not heal. And you have to just avoid swimming, avoid getting water in the ear, or you can go into the water, just keep your head out. If the little bones start to heal together, let's look at the little bones. What if these little joints here start to heal together? Either there's fluid behind the eardrum or you've got a disease called otosclerosis. The bones healing together and they won't vibrate, then you have to have part of them removed. So here's the eardrum. The stirrup has been removed here, so you can look a bit closer. Little stirrup has been removed and a metal or plastic insert has been put in. This is quite delicate surgery. It's fairly complex, I would think. And that then touches the cochlea, so the cochlea will get the vibrations from conductive hearing. Let's look at the cochlea. There's the cochlea there. So it's, as I told you, like a snail. Not too many people know they have 2 snails in their head. There's the auditory nerve. And if there's any obstruction in here, you can get some conductive deafness, some nerve deafness. Obstruction here, you can get some nerve deafness. If the nerve doesn't work at all, don't get a hearing aid. It won't work. Yeah. So if the nerve doesn't work at all, a hearing aid won't work. Let's look at the cochlear implant. Here's the cochlear implant. The specialist has put some, like an electrical wire going through here, like a wire catheter. And that will stimulate the spiral nerve in the brain. So you have to have an exterior receiver. Have an exterior receiver outside the skull. This actually may be behind the ear. It receives radio waves, and the radio waves go through here. Radio waves are detected inside the skull, so you can imagine it's tricky surgery to do all that. Then the sound from here goes into the cochlea and you can hear a little bit. This assumes that there's absolutely nothing you can improve in here, that none of this is working and that only a cochlear implant would work. Let's look at the auditory brainstem implant. Auditory brainstem implant assumes that your brain can hear but that the nerve and the cochlea aren't working very well. So once again, there's an exterior receiver here transmitting radio waves inside the skull. Once again, there must be some unpleasant surgery involved. And the electrical conduction goes behind the cochlea down to the brainstem, avoiding the nerve and the cochlea. What's the best way to treat hearing loss? If your conductive deafness here is the worst part, hearing aid is the best. You can put a little hearing aid there. Little hole through there conducts ordinary sound. If your battery wears down, you'll still have ordinary sound coming through. If the battery's working, this will augment the sound, making it much louder and instantaneously out with ordinary sound, vibrating the eardrum and the little bones here. You should wear your hearing aid all the time. If you're going to have a shower, take it out. After the shower, dry your ear out with your 5th finger here with some tissue. Dry it quite well 3 or 4 times, and then you can put your hearing aid in. If you have your glasses on, you should have your hearing aids in. There's no reason not to wear your hearing aids. If you don't wear your glasses, you don't go blind, but if you don't use your hearing aid, your deafness will get much worse. In other words, you're not only using the hearing aid to hear, you're using it to treat the deafness and prevent it from getting worse. This is Dr. John Luther on hearing. I'm a retired doctor, so any problems you have here, you'll have to see your own family doctor. Ear, nose, and throat specialists are covered in Canada under Medicare for all citizens and immigrants. And audiologists, you sometimes have to pay, but it's not that much for the tests. Just a little bit pricey for the hearing aids. Dr. John Luther, over and out.